This program is sponsored by
Lanka Hospitals, caring, curing. This is our Centre for Blood Disorders, probably the leading centre in Sri Lanka, offering comprehensive diagnostic and treatment facilities for all blood-related disorders, including blood cancers such as leukemia, myeloma and lymphoma. Our dedicated treatment facility comprises of chemotherapy for all blood cancers, including bone marrow transplant treatment. Lanka Hospitals, caring, curing.
Hello everybody, welcome to our television's Mediline. We have this program specifically in tune with your health, your well-being and giving you the very best, of course in collaboration with Lanka Hospitals, one of the finest establishments in Sri Lanka, providing the very best of services across all health-related necessities for Sri Lankans as well as for international representatives, international visitors who come with the best of service offered through, of course, the best of specialists. On the subject of the best of specialists, I am honored and I have the pleasure of having a guest on board today. He is in fact a gentleman who has over 19 years of experience overseas, especially in the United Kingdom, but now he has returned back to Sri Lanka and he heads for Lanka Hospitals, the Haematology unit. We're very happy to say a warm welcome to Dr. Saman Hewamana. He is a specialist in clinical hematology and hemato-oncology. Doctor, thank you for being with us first of all. It's an absolute pleasure and honor to have you. We'll start off, Doctor, by, I think the first question I'd like to ask you is, let's define the difference between hematology and hemato-oncology.
Now we have these overlapping specialties, hematology, hemato-oncology and oncology. Now hemato-oncology is the area where you specialize in treating blood cancers. If you look at hematology, hematology is the area where you do work or specialize in blood related disorders. So blood related disorders or disorders which comes in the blood can be cancer or non-cancerous. Similarly, if you look at cancer, so the specialty oncology, it deals with different types of cancers. And over decades, we have recognized those cancers come due to different reasons and they behave completely differently. And also they are treated completely differently. And if you look at even the mortality, why patients die due to cancers, different cancers have different mortality, reasons for mortality, different reasons why they die. Now I specialize in treating blood cancers, which is a type of a cancer. So if you look at the big basket of cancer, blood cancer is one. So blood cancer basically involve leukemia, lymphoma and myeloma, and there are certain other subtypes that is in the big basket of cancer, but at the same time they have more differences than similarities. Now if you look at breast cancer and compare it with blood cancer, how people get breast cancer and blood cancer are different. How we stage them are different. Who get them different. And how we treat them is different. How people die, what is the main reason why people with blood cancers die? Or if we put it positively, by doing what we can save these patients or cure them and live them longer is different. So, and similarly, if you look at other cancers also, we are recognizing more and more with the newer technologies and analyzing the data, what happened to patients over last few decades with different types of cancers, we are in the process of treating them differently. We don't put it in the same basket. In developed world, there are specialists in each sub area of cancer. There are breast oncologists. I'm not telling that we can apply everything in the UK to Sri Lanka tomorrow. There is a way to go. It takes time, and this is a developing country, so government has to bear all the cost in training of these consultants. However, that's the way forward. So there are breast oncologists, there are hematologists who treat only blood cancers. Now I treat only blood cancers. I don't treat breast cancer and lung cancer and all sort of other cancers. So when we recognize these cancers are different, and also when we realize within each cancer type, if you look at blood cancer, there are hundreds types of different cancers inside that. So normal human brain cannot deal with all the cancer. So that is the reason we specialize, and that gives a better survival and ultimately benefit to the patient.
Right.
And also benefit to the consultant, because less stressful and we can concentrate on one thing.
Right. Dr. Sana, I'm just going to take a little extract from everything you said. You mentioned that there were 3 in the basket of blood cancers. There were 3 types.
Yeah.
And then you also mentioned the fact of this mortality rate to keep someone, a patient who's probably been diagnosed with one of these cancers, going on for long. Generally, is it something, obviously in your expertise, experience, specialization, could we say it is curable?
Yes, and the mainly in the hemato-oncology or blood cancer group, we have leukemia, lymphoma and myeloma. Inside those, there are different types again.
Right.
Now, if you look at leukemia, in that heading, under that heading, you can list so many different types of leukemias. Some are curable, but all are treatable. If you look at a leukemia called chronic myeloid leukemia, people with chronic myeloid leukemia getting diagnosed these days, 90% of them you can see after 10 years. We say like 10 years survival is closer to 90%. But that is not curable. It is a chronic disease like diabetes. If you look at acute myeloid leukemia, inside acute myeloid leukemia there are different subtypes. And there is one subtype called acute myeloid leukemia with 821 translocation. That's a genetic translocation. Out of that, about 50-60% get cured. Now that word cure we can use in that particular group.
Right.
So some are treatable and they are like diabetes, can control. Some leukemias get cured, and there's another leukemia called APML, acute promyelocytic leukemia, and we call PML. That is a leukemia with a special genetic translocation called PML rara. That is about 90% curable. And couple of years back, before the medicine like the hemato-oncology or the blood cancer care developed, it used to be 100% fatal disease within weeks. So if you treat properly, they get cured. And those experience and the protocols and the diagnostic methods come from the West. So they have detected how to diagnose them and the best treatment to cure them. Did that answer your question?
Yes, it did, Doctor. In fact, I think that led to a lot more questions which we will get into in the next few minutes. Now we're going to take a little bit of a different spin, Doctor. There's a lot of information about you out there, which is all wonderful stuff. I would say you're a celebrity in your own field here in Sri Lanka. Tell us a little about yourself, Doctor. I mean, getting into this field, what specifically got you interested, a little bit about your experience overseas and here as well.
It was not very well pre-planned. I went to Ananda College in Colombo, then did my MBBS in Colombo University, Colombo Medical Faculty. I'm basically a physician, so I wanted to become a physician in contrast to a surgeon. So I wanted to work in the field of physicians areas. But from small days I wanted to work in the area of cancer. When I was in the medical faculty, I became a member of Sri Lankan Cancer Society and used to go and do volunteer work in Maharagama, now it is called Lanka Hospital. Anyhow, I didn't do oncology in Sri Lanka, I did medicine. or where you become a physician. After I went to UK, I found this specialty called clinical hematology done by physicians in the UK. So it's little different to Sri Lanka, Sri Lankan system. Sri Lankan physicians become cardiologists, nephrologists, but after becoming a physician, they don't subspecialize into hematology in the Sri Lankan setting. But they do to other specialties as I mentioned. But in the UK, after doing the MRCP or after becoming a member of Royal College of Physicians, they do like in Sri Lanka nephrology, cardiology, etc. and hematology. So that's a physician's field. Sometimes we call it clinical hematology, sometimes just hematology, because all the hematologists in the UK are physicians. There I started that again because of my desire to do with oncology part. After finishing my training or just before finishing, I was in Cardiff. At the time the prof offered me to subspecialize into hemato-oncology, where I did a PhD. So I have been accumulating a lot of degrees. Did a PhD related to leukemia. I worked for a while as a consultant in bone marrow transplant in University Hospital of Wales, that's in Cardiff. Then moved back to London. I started my training in London, went to Cardiff, came back to London to a place called Royal Marsden Hospital in London. That is a very big cancer center, or the cancer center in the UK, or the biggest cancer center in Europe. So there's a huge standalone cancer center where I work as a permanent consultant in hemato-oncology. We had a unit, there are about 10-15 consultants there. We did about 300 bone marrow transplants a year, so there were separate 3-4 consultants who will subspecialize into specialties in hemato-oncology itself. Right. So there is such a center headed by, at the time, by Professor Gareth Morgan. Due to various reasons, 5 years back I decided to come back to Sri Lanka. Firstly on sabbatical, I got sabbatical. I was invited to come back to Sri Lanka by several people, not to forget Dr. Jayantha Balawardana. He is the main man who asked me, and some ministers from the previous government and the present government also asked me to come back to Sri Lanka. So I decided first to come back on temporary basis without resigning to test the water. Finally I resigned from UK and came back. So that is what I did, and we have developed a hemato-oncology unit here. And oncology is fairly developed in Sri Lanka, but I think it is in the process of subspecializing into different subspecialties within oncology. And after we started the unit in Lanka Hospital, we were asked to train some oncologists from Maharagama. Again, that was by Dr. Jayantha Balawardana and Dr. Mahendra Perera. They are legends in oncology, very famous oncologists in Sri Lanka. They are the ones who have developed this field of oncology to this level. Not to get angry with me with other oncologists. There are so many other oncologists who are very senior and also junior oncologists who have developed the field of oncology in Sri Lanka. But those two names are very prominent. They asked me to train, and also Dr. Dehan Gunasekara. I have still with me the request letters they sent from the College of Oncologists. So we train 4 doctors in Lanka Hospital to subspecialize into hemato-oncology, and also we do a fair amount of clinical work and a little bit of laboratory work, teaching. That is all. Okay. At the moment.
That's all. So, doctor, when it comes to, let's say, I know this is a very tough one, because sometimes sitting on the outside as an individual, we tend to question a lot of things about doctors, but we don't really realize the strain they take when you're putting or submitting a patient's life into their hands, and they are basically walking the thin line. And I know that probably is very stressful when you're taking someone else's life into consideration. How many cases have you seen so far since your return back to Sri Lanka within your unit itself?
We have treated thousands of patients in Lanka Hospital, it's not hundreds, in the hemato-oncology center or the clinical hematology center. So we majority are with blood cancers. Also we have some hematological problems, not cancer related. Now, the main problem in Sri Lanka developing and practicing this specialty is money. Even if you go to the government sector or to the private sector, treating a cancer patient is very expensive. So it is not cheap in the government sector, maybe more expensive. The difference is the government bear the cost. So that's the difference. And here in the private sector, the patient actually realize how expensive it is. It is very stressful because of that. Like we know that some people, okay, we have a hemato-oncology center, we treat only blood cancers, I treat only blood cancers. Due to financial reasons, they can't afford treatment in the private sector. That of course is sometimes beyond my control. We have developed a charity that is also again from patients' donations. So patients who got treated in Lanka Hospital Blood Cancer Center started a charity and donated their excess money or whatever they have. So with that we help some patients, that is called Lanka Hospital Blood Cancer Charity. For needy people, there is a strict criteria managed by the hospital and governing board. We help people. So that's the kind of heartbreaking side. Due to your financial status, sometimes people can't get the best health care in Sri Lanka. And UK it's very easy because it's the National Health Service. I still work about 20% or so in the UK National Health Service as a specialist in the field. There you don't have to deal with that part. You just do your job and the government will do their job, looking after their or giving the best available drugs at that moment. So that is called standard of care. So getting standard of care in the UK has no financial obstacles. Here we have that. That's the bad side. But the good side is there is a different emotional attachment to the patients here. Like you get emotionally attached. It is more of an art dealing with the patient, particularly in the Sri Lankan setup. And we have treated so many patients. We are in the process of looking at their data, and we have cured a lot of patients. And also we have make a lot of patients live longer.
Thank you, doctor. I think that was very intriguing. It was also very eye-opening that the hospital of a private sector and the patients itself have gone into such a worthy cause. So we're going to take another quick break, but on the other side we have just a few more questions to delve into. If you just joined us, welcome to our television Mediline.
You're watching this program sponsored by
Lanka Hospitals, caring, curing. This is our Center for Blood Disorders, probably the leading center in Sri Lanka, offering comprehensive diagnostic and treatment facilities for all blood-related disorders, including blood cancers such as leukemia, myeloma and lymphoma. Our dedicated treatment facility comprises of chemotherapy for all blood cancers, including bone marrow transplant treatment. Lanka Hospitals, caring, curing.
Back on our television Mediline, we are here with Dr. Saman Hewamana, and doctor actually took us through experiences that he's had, the challenges that doctors even have to face in Sri Lanka, which are quite tough, but at the same time some positive opportunities through both the team as well as Lanka Hospitals that patients can look to. Now we're going into the final part, and in the final part, doctor, I'd like to focus on the hemato-oncology unit here at Lanka Hospital. Could you tell us about the specialities, the services, the facility itself that patients could look to, and what differentiates this from any other service?
Now, when I first came to Sri Lanka on sabbatical, I saw a couple of patients. We used to treat them in general medical wards. And later on, after I permanently came back to Sri Lanka and decided, okay, I'll develop this unit here, we have moved to a special location. It is special because we get only patients with blood cancers to that unit. So that is probably the single most important thing in blood cancer care. If you look at, as I previously mentioned, why people with blood cancers die, 90% of the time is because of infections. There is a law in the UK, doctors have to be bare below elbow. That's why I don't wear long sleeved, no tie. So you can't wear even a wristwatch. That is to reduce the risk of infections. So we have a unit, is not the unit I work in the UK, but developed very in a similar way to the unit I have worked there, only for blood cancer patients, also with the facilities to do bone marrow transplants. Again, if you look at the centers in the UK, there are no bone marrow transplant units. There are blood cancer units. Inside that you have bone marrow transplant units. So we have the same anatomical setup here, and we take infection control very seriously, because that is why patients die. We have facilities to give chemotherapy. We have facilities to monitor them. We have specially trained nurses who will treat only patients with blood cancer. I treat only blood cancer, so the nurses in the unit also treat only blood cancers. But this is not my unit. It is managed by a couple of oncologists. We have pediatric oncologists coming here. We have, again, as I mentioned, Dr. Jayantha Balawardana, who look after patients. So we have a group practice or care shared by general oncologists and myself, supported by transfusion consultants, microbiologists. Then we have a clinical nurse specialist who she is trained to deal with a lot of medical issues before a doctor can reach a patient. Even MOs, as it's extremely difficult to have 24-hour single MO cover. So as much as possible, we try to get MOs who are working only in that unit.
Right. So that's a lot of confidence vested there, because there is the professionality, there is the service, then there is also people who come with a sense of skill and training. So that's a very good comfort zone, I think, to someone who probably is going through this and needs to. On that note itself, probability of going through it, people today have a tendency of using Google as their doctor, and I think before they go to the doctor, they diagnose themselves. And I know some of the doctors who have spoken to find this really funny, because they say, the patient comes and sits with me and they have already diagnosed themselves according to WebMD. But when we talk about this itself, doctor, blood cancers itself, what would a layman have to be aware of, be certain of? How can you pre-screen yourself to make sure you haven't genetically, like you said, contacted this, or it has built through time? How would they go about that process?
Again, there are differences between different types of cancers, and for blood cancers there are no screening tests. Now you do mammograms for breast cancer screening. There is a bowel cancer screening test in the UK for bowel cancer for people who are more than 50, and the pap smear, so that's for the cervical cancer. There is no screening test for blood cancers. A lot of blood cancers go asymptomatic for a long time before we realize, and that will be detected in a routine blood test. Some people become symptomatic, as you told, fever can be symptom of leukemia, but everybody having fever is not having leukemia. So the best thing is see a good physician. I am a physician, as I told you, in the UK training, before you can do hemato-oncology, you have to become a physician. You have to do the MRCP. So if you have any concerns, I'm not asking you to come and see me. See a good physician. I'm also a physician, so there are a lot of people come to me saying, they have things not related to blood cancers. If they feel tired, fever, I see a proportion of patients who are not coming into my subspecialty as a blood cancer specialist, but I see them as a physician. So those people can be seen by a good physician. So a general physician has the ability to direct them, even your GP.
Okay. Last question, doctor. I know this is a very far shot to ask, but if we take the context of, let's say, the past 10 to 15 years, do you see a rapid growth, rapid increase, maybe due to technological factors, things that people ingest, their lifestyles, etc.? Do we see a rapid growth in this?
Yes. Certain cancers definitely the incidence, one is non-Hodgkin's lymphoma. The incidence is going up, and that is in the Western setup. We know for sure the cancer incidence, some cancers incidence is going up. In Sri Lankan setup, yes, it is going up, but mainly it is going up due to two reasons or three reasons. One, because it's going up actually. The main reason is we diagnose them more. Now, like my grandfather, I don't know why he died. Right? My father told, okay, he died.
But there is no
We
specific.
don't know why. And also, if you ask from somebody what happened to your mother or father, whatever, they say had cancer. What cancer, don't know. So we know things more and more now. Like cancer is not one thing. Cancer is like calling there is an animal in the jungle. That's what I was told by one of the professors when I started blood cancer. He telling somebody has leukemia is like you are calling there's an animal in jungle. You don't know which one. How to rear or catch a rabbit is different to how to rear or catch an elephant.
Yeah, so
An elephant is different to a tiger. So you have to be, so we have more knowledge, and also blood cancer patients, particularly blood cancer patients, I know for sure they live longer. When I was a medical student in Columbia University, long time back, that is, multiple myeloma was a deadly disease. 6 months, you die. Now it is like diabetes. It's not curable still, even if you go to States.
but it's manageable.
It's very manageable. Nobody has cured diabetes. Like maybe there are few reports of pancreatic transplants, but diabetes is not a curable disease. It's a manageable, it's a treatable disease. So myeloma is not a curable disease, it's a treatable disease. So people live longer. Like we ultimately everybody die from something. So my job is to make sure that my patients don't die from the blood cancer. You may die from a heart attack. If you look at the mortality or why people die in the world, cancer is not the main cause. It's the cardiovascular disorders.
Right.
Because they live longer, we diagnose more. Maybe the incidence of some cancers going up, and we feel like it is going up rapidly.
Right. Thank you, doctor. I think that was a very informative session, especially for someone who's an average layman out there who's concerned about their health or might have a friend or family member, someone known to them, having such a challenge. That being said, we are going to say thank you again for the time, doctor. It was a pleasure having you. And as always, Lanka Hospitals is one of the many places in Sri Lanka, but the only, I would say, that offers the best healthcare facilities, the best testing, and of course the overall best service. So you know exactly where to come to if you need the right treatment, which is combined with all the other positive factors. Thank you once again for joining our television's Mediline. We wish you all a pleasant week.
This program was sponsored by
Lanka Hospitals. Caring, curing.